choosing the right method of birth control can be overwhelming, especially if you have a personal or family history of blood clotting. Informed decision-making in reproductive health is crucial, especially if you're affected by genetic thrombophilia, an inherited medical condition that increases a person's risk for life-threatening blood clots. One of the most common forms of birth control, estrogen-based birth control like the pill, patch, or ring, is known to increase a woman's risk for dangerous clotting. And, if she has a genetic clotting condition, this risk can increase dramatically. In fact, women with the genetic clotting disorder factor V Leiden, who also use contraception that contains the hormone estrogen, have a 35-fold increased risk for blood clots. The debate that surrounds genetic testing for thrombophilia before starting estrogen-based contraception is complex and involves many factors, such as costs, effectiveness, and discrimination. While current guidelines advise against universal thrombophilia testing before choosing birth control, some studies show that selective screening of women with a personal or family history of blood clots is more feasible. Proponents of such a patient-centered approach to healthcare stress that identifying individuals at higher risk for blood clots will help minimize other risks and also help to protect their health and well-being. The Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and that also ensures that the patient's values guide all clinical decisions. Let's take a closer look at this debate. Cost can be a barrier to genetic testing. Some argue that the costs, which can be steep, are not warranted since only a small number of people actually have the genetic mutations that cause thrombophilia. But for others, the value of preserving health and saving lives outweighs any financial concerns. Access to genetic testing informs decision-making and helps women make choices about birth control to meet their personal preferences and specific healthcare needs. While the absolute risk for blood clots among people with a known genetic clotting disorder may seem low, because not everyone affected by thrombophilia will experience a blood clot or require treatment, personal factors can influence thrombophilia outcomes and should be considered. Patient-centered care allows a woman to choose among different contraception options and make an individualized choice aligned with her unique health profile. Both effectiveness and safety are crucial when selecting contraception. Options like copper intrauterine devices or copper IUDs and progestin-only pills do not pose the same clotting risks as estrogen-based contraception, and they provide safe and effective alternatives for women with genetic thrombophilia. The potential psychological impact of genetic testing also is crucial. While results may cause concern or worry, research shows that most individuals find value in knowing their risk for blood clots. Genetic counselors are key during the testing process and can help individuals understand what their test results mean and get the support they might need. Discrimination is also a serious concern that genetic counselors can help with, because there is the potential that having a genetic condition like thrombophilia might result in unfair treatment at work or when buying insurance, for example. There are laws in place to protect against this type of discrimination, but it's crucial that anyone considering genetic testing understand these decisions and the potential impact of their thrombophilia status. Issues involving discrimination might deter some people from getting tested. Navigating reproductive health with genetic thrombophilia is challenging, but with support and information, women can make empowered choices. Armed with this knowledge, women can actively engage in discussions with their healthcare providers, participate in shared decision-making, and choose contraceptive methods aligned with their genetic risk profile. You can learn more and download a list of questions to discuss with your doctor about genetic testing for thrombophilia by visiting the Rowan Foundation website at alexrowanfoundation.org.